In 2022, roughly 2.3 million people worldwide received the exact same diagnosis: breast cancer. Unlike a virus or a bacterial infection that invades from the outside, this disease is entirely homegrown. It's the result of a critical malfunction originating inside our own cellular machinery. To see how a global health crisis of this scale actually works, we have to look past the top-line numbers and observe the problem at its absolute smallest scale. Most breast cancers begin right here, inside the epithelial cells that line the milk ducts of the breast. Normally, these cells operate on a strict biological timer. They grow, divide, and eventually die off in a highly regulated sequence. Over time, environmental hits damage a cell's DNA. If hits accumulate too fast, the cell mutates, disabling its tumor suppressor genes. The internal breaks. Without them, the cell clones rapidly, clumping into a tumor. Eventually, these rogue cells can break away from the initial tumor and travel through the bloodstream to invade other organs, the threshold known as metastasis. Cancer is a process of escalating internal failures, where a single microscopic error threatens the entire system. While many of these DNA mutations occur over a lifetime, for some, the vulnerability is built into their DNA from birth. This is the scope of heredity. About 5 to 10% of breast cancer cases are caused by damaged genetic instructions passed down from a parent. The most well-known of these are the BRCA1 and BRCA2 genes. When these specific blueprints contain a mutation, the risk of developing breast cancer increases by more than 75%. Genetics load the gun, but environmental and hormonal factors are usually what pull the trigger. Natural hormones often act as the primary catalyst that promotes the survival and growth of these mutated cells. In many breast cancers, elevated levels of estrogen and progesterone act directly as fuel, signaling rogue cells to multiply much faster than normal tissue. This creates a direct link between prolonged hormonal exposure, such as through long-term hormone replacement therapy, and a higher statistical risk of cancer. Understanding this hormonal environment is critical because it identifies a specific biological vulnerability that modern medicine can exploit. When caught before it spreads, breast cancer has a very high cure probability, shifting the focus from risk to an actionable medical defense. The primary physical intervention is surgery, removing the localized tumor entirely before metastases can take hold. Surgeons and oncologists then use systemic tools like chemotherapy and radiation to sweep the body, destroying any remaining cells that show signs of rapid abnormal division. For hormone-sensitive cancers, medications like tamoxifen or aromatase inhibitors act as a preventative barrier, starving the cancer by blocking its access to estrogen. These multi-stage interventions allow us to directly counter the biological catalysts that allow the disease to thrive. Beyond the clinic, personal agency plays a significant role. Roughly a third of all cancer deaths are tied to modifiable lifestyle behaviors. Behavioral changes, such as adopting plant-rich diets, regular exercise, and avoiding alcohol, help regulate the body's internal environment and prevent estrogen spikes. The most powerful defense remains interception, stopping the rogue cells before they mature into significant tumors. Routine mammogram screenings are the gold standard for early detection, often identifying anomalies years before they can be felt. Peeling back the biology of breast cancer moves it from the realm of unpredictable threat into a manageable, preventable reality.